If you wake up every morning with a dry mouth, sticky lips, and that uncomfortable feeling in your throat, your body may be trying to warn you about something important. This is not something you should simply brush off, and it is certainly not always harmless. Behind what seems like a simple symptom, there may be a medical issue that many older adults completely overlook. In some cases, waking up with a dry mouth can be one of the earliest signs of a silent health problem that has been developing for a long time without being noticed. Every morning you ignore this signal, you may be allowing your body to weaken little by little. In the next few minutes, I want to explain exactly what your body may be trying to tell you and, more importantly, what you can do starting today to protect your health. I am speaking here from the perspective of senior health because this symptom is especially common after the age of 60. Many people think it is just a normal part of aging, but that is not always true. Let me tell you about a 68-year-old man. For 3 years in a row, he woke up every single morning with an extremely dry mouth, cracked lips, and intense thirst. He thought it was simply because he was getting older, or maybe because of the heat where he lived. Every morning he drank a big glass of water and continued with his day without thinking much about it. Then one morning he collapsed in his kitchen. He was rushed to the hospital, and the doctors discovered that his blood sugar level was 3 times higher than normal. He had type 2 diabetes that had been silently progressing for years. That dry mouth was the warning sign his body had been sending him every morning, but he never realized it. Sadly, this is not an isolated story. Many people ignore dry mouth for months or even years, only to later discover that it was linked to something much more serious. To understand why this happens, you first need to know what saliva actually does. Saliva is not just water inside your mouth. It is a complex biological fluid produced by your salivary glands, and it plays a major role in your health. Your body normally produces between 1 and 1.5 liters of saliva every day. This happens continuously, but production drops during sleep. That is why it is normal to wake up with slight dryness. But there is a big difference between a little morning dryness and waking up with a mouth that feels completely dehydrated. When your mouth is truly dry after sleep, it means your saliva production is abnormally low. Doctors call this xerostomia, and it should not be ignored. Saliva protects your teeth by neutralizing acids produced by bacteria. It helps you chew and swallow food properly. It makes speaking easier by lubricating your mouth and throat. It also protects the lining of your mouth against infections. Without enough saliva, your entire oral balance is affected. One of the most common causes of dry mouth in older adults is medication. If you regularly take medicine for blood pressure, heart disease, cholesterol, anxiety, or depression, there is a real chance that one or more of those drugs may be contributing to your symptoms. More than 400 medications are known to reduce saliva production. Diuretics, for example, remove water from the body, including the water needed to make saliva. Antidepressants and anti-anxiety drugs can affect the nervous system in a way that slows down salivary gland activity. Sometimes the person suffers from dry mouth for years without ever linking it to the medication they take every day. Another major cause is diabetes. When blood sugar is poorly controlled, the body tries to get rid of excess sugar through the urine. This leads to frequent urination and a constant loss of fluids. Over time, this creates dehydration, and the salivary glands no longer have enough water to work properly. If your dry mouth comes with intense thirst, frequent urination, especially at night, and unusual fatigue, it is very important to check your blood sugar. A third common cause is breathing through the mouth during sleep. Many older adults do this without realizing it. It may be caused by chronic nasal congestion, nasal polyps, a deviated septum, or sleep apnea. When you breathe through your mouth all night, the air passes directly over the tissues in your mouth and dries them out. Imagine a fan blowing on your mouth for 8 hours. That is essentially what is happening. This is why some people wake up not only with a dry mouth, but also with a dry throat and bad breath. Another possible cause is autoimmune disease. One important example is Sjögren's syndrome, a condition in which the immune system attacks the salivary glands and tear glands. People with this illness often have both dry mouth and dry eyes. It is more common in women after menopause, but men can also develop it. Because it progresses slowly, many people assume the symptoms are just part of getting older. Chronic dehydration is also a major reason. Many seniors simply do not drink enough water during the day. As people age, the sense of thirst naturally becomes weaker. That means a person can be dehydrated without even feeling very thirsty. If you are not drinking enough water regularly throughout the day, your salivary glands cannot function well. The result is often a dry mouth, especially after a full night of sleep. Smoking and alcohol can make the problem worse, too. Tobacco constantly irritates the tissues in the mouth and reduces saliva production. Alcohol is also dehydrating, especially when consumed in the evening. If you smoke or drink regularly, your chances of waking up with a dry mouth are much higher. The problem is that dry mouth is not just uncomfortable. If it continues for a long time, it can cause serious consequences. People with chronic dry mouth have a higher risk of cavities, gum problems, fungal infections like oral thrush, and difficulty chewing and swallowing. Some even begin to eat less because food becomes unpleasant to swallow, which can eventually lead to weight loss and malnutrition. What seems like a small symptom can end up affecting your nutrition, your teeth, your sleep, and your overall quality of life. The good news is that there are practical steps you can take. First, drink water regularly throughout the day instead of waiting until bedtime. Small amounts spread across the day work much better than trying to drink a large amount all at once. Keep a bottle of water nearby and make hydration a habit. Second, consider using a humidifier in your bedroom, especially if the air in your home is dry. Third, talk to your doctor about your medications. Never stop them on your own, but ask whether one of them could be causing your dry mouth. Some people also find relief with simple natural habits. Drinking lukewarm water with a little lemon can help stimulate saliva because the acidity activates the salivary glands. Chewing sugar-free gum during the day can also help because chewing naturally increases saliva flow. Foods rich in water such as melon, cucumber, oranges, strawberries, celery, and tomatoes may also support hydration. At the same time, try to reduce very salty foods, very sugary foods, and too much caffeine if you notice they make the dryness worse. If you have been waking up with a dry mouth for weeks or months, do not ignore it any longer. Pay attention to what your body is telling you. Speak with your doctor, especially if the symptom comes with thirst, fatigue, dry eyes, snoring, or frequent urination. You should also tell your dentist, because protecting your teeth and gums is essential when saliva is reduced. A dry mouth may seem minor, but sometimes it is the first clue that something deeper is going on. The sooner you identify the cause, the sooner you can protect your health and feel better. Take it seriously, take action, and listen to the warning signs your body is sending you.